In this topic, we're going to discuss contraception and the birth control pill. So by the end of this topic, you should be able to answer the questions: what is contraception? What are the different types of contraception, and how does the contraceptive pill work? What is the morning after pill? What are the biological and social implications of the pill? So what is contraception? This is the intentional prevention of conception by some means, so natural or artificial. And conception is the formation of a viable zygote by fertilization. So when fertilization is intentionally prevented, we call this contraception. You've got different types of contraception. You've got sterilization, prevention of ovulation, barrier methods, and behavioral methods. So sterilization is the cutting or tying of the vas deferens in males, as you can see here, and we call this vasectomy. So it prevents the sperm becoming part of the semen. Similarly, if you cut or tie the fallopian tubes, this will prevent the secondary oocytes reaching the uterus. Prevention of ovulation forms the basis of the contraceptive pill. This is when the secondary oocyte is not released from the ovary. We'll look at that in a moment. You've got the barrier methods. These are any physical or chemical barriers that prevent the male and female gametes meeting. So this includes condoms, diaphragms, and spermicides. And then finally, behavioral methods. This involves either abstaining from sex altogether or confining to those days of the menstrual cycle where the secondary oocyte is not available for fertilization. Now, birth control is slightly different from contraception. Birth control is the voluntary limitation of the number of children conceived. So in other words, choosing if and when to have children. Contraception thus plays a major role in birth control. Now, some forms of birth control are not technically contraception. For example, intrauterine devices, morning after pill. These actually prevent the fertilized egg implanting. Right, let's have a look at the contraceptive pill. You've got a number of different types, and they don't always come in the pill form. Contraceptive pills contain synthetic forms of one or both of the hormones progesterone and estrogen, and these hormones may be given as a pill, which is taken by the mouth, or an injection, or an implant under the skin, or a vaginal ring. So you've got two types of oral contraceptive pills. The mini pill, which contains only one hormone, is a synthetic form of progesterone. And then you've got the combined pill, which contains two hormones, the synthetic form of progesterone and estrogen. Now, these pills are taken daily at the same time. They are packaged so that the course can be followed throughout a 28-day cycle. So you've got 21 hormone pills and then 7 placebos. So those 7 placebos are when the girl is menstruating. So how does the contraceptive pill actually work? Well, it prevents ovulation. It makes the endometrium of the uterus thinner so that implantation of the ovum is less likely. It also thickens secretions around the cervix, so it forms a barrier to sperm reaching the uterus. So looking at what happens in terms of hormones, you've got the synthetic progesterone affects the hypothalamus, and this inhibits the release of gonadotrophin-releasing hormone, GnRH. This decreases the secretion of both FSH and LH from the anterior pituitary gland. So this prevents the development of the follicles in the ovary. This means that the luteal phase is mimicked. So there's no mid-cycle surge of LH, Therefore, there's no ovulation. And because there's a decrease in FSH, further follicle development is also inhibited. Remember that the pill also thickens the secretions around the cervix, so it forms a barrier to sperm reaching the uterus, as well as making the endometrium of the uterus thinner, so implantation of the ovum is less likely. The morning after pill can prevent pregnancy where contraception either failed or was not used, and a woman thinks that she may have conceived. The name is not really accurate as the pill can be taken up to 72 hours after sex, although its effectiveness diminishes with time. So what the morning after pill does is it prevents ovulation. It also alters the lining of the uterus, making implantation of a fertilized oocyte very unlikely. You need to know the biological implications of the pill. So a positive biological implication is that it reduces the risk of ovarian cysts, as you can see here. It may be used in the treatment of some conditions such as polycystic ovarian syndrome. So this is when the ovary gets multiple cysts in it. It reduces the risk of certain cancers of the ovary and uterus. And menstruation is more regular, and there's also reduced PMS. It also reduces the risk of pelvic infections because of that plug by the cervix. And then there are reduced unplanned pregnancies. Can you think of negative biological implications of the pill? Well, it increases the risk of blood clots, increase in blood pressure. There's a possible association with an increased risk of breast cancer. It may cause tiredness, mood changes, depression, nausea, and headaches. And it's contraindicated in women with circulatory disorders, obese women who smoke and who may have high cholesterol. Okay, social implications. Women may have children later. This means that it can suit their social and economic conditions. The children born are therefore more likely to be better cared for. Women are also more involved in the workplace because they've got greater control of their own bodies and their own fertility. It therefore promotes gender equality and women's autonomy. Therefore, these women have greater freedom to go to work. Fewer children means that the world population can be limited, so that there's sufficient food and other resources for mankind, and therefore less poverty. Fewer unwanted pregnancies. There is a possible increase in sexually transmitted diseases, STDs. This could be due to greater sexual freedom and promiscuity. And that concludes our lesson, the end.